And Carla says, I have just been told that my little girl who is 1 is lactose intolerant. And my doctor told me to speak to my health visitor, but my health visitor told me to speak to my GP, so she's getting a bit of a run around there. She is constantly vomiting with cow's milk and has green poos, which I'm sure isn't right at 1. She says she still feels lost with what to do and things are just not getting better and she's not getting any help from anywhere. So what do you suggest that she does?
From my parents' point of view, you'd be going berserk.
You'd be going nuts because she's trying to get help and she's not getting, obviously.
This is something we hear from patients all the time, is that unfortunately there's a lot of conflicting advice that they get, and this will often conflict also with what they're reading about on the internet as well, so it is very difficult. Lactose intolerance and milk allergy are often confused, and in fact sometimes the terms are used interchangeably, which really doesn't help because they're actually completely different things.
Right, so can you define...
Okay, so milk allergy is a problem with your immune system where it doesn't like the protein that's in milk, whereas lactose intolerance doesn't involve your immune system, and it's to do with the sugar in milk. So lactose intolerance is quite common in infancy. Cow's milk has got lactose in it, it's the main sugar in milk. When you drink milk, that sugar is broken down by an enzyme in your gut, and it breaks it down and you get rid of it, no problem.
Right.
When you've had an infection in your gut, so a gastroenteritis, a bit of a tummy bug, very, very common, particularly this time of year, then the lining of your gut gets a little bit inflamed, and that's where this enzyme is kept. So it gets eroded away, and there's not enough of it to break down that sugar in the milk. So what will happen for a few weeks until your gut gets back to normal, when you drink lots of lactose in cow's milk or in formula, then there's not enough of the enzyme there, so it doesn't break the sugar down, so you end up with diarrhea. Okay?
Right.
You don't get vomiting. Vomiting is not a symptom of lactose intolerance.
Right.
Okay? So the classic infant lactose intolerance story would be baby gets an upset tummy, bit of vomiting, bit of diarrhea for 4 or 5 days, then they're clearly perk up, they're better, they're keeping their food down, but they've still got diarrhea, and the diarrhea lasts for 3 or 4 weeks and then it stops.
Right.
And if it's bothersome, go on a lactose-free formula, everybody's happy, it gets better.
Right.
So it's a pretty straightforward condition to deal with.
Okay.
Okay. Cow's milk allergy is different because the symptoms will be far more persistent, and they can start at any point during infancy. And what you'll find is that when you're drinking formula, anything with the cow's milk protein in it, then you'll get one of the symptoms, possibly sometimes, is diarrhea. Vomiting would also be a possible symptom.
Right.
And those would be persistent, and you could switch onto a lactose-free formula and nothing would change because, of course, it's still got the cow's milk protein in it.
Right, I see. So what do you think
I'm guessing
Carla
that, yes, I think if Carla has tried a lactose-free formula, which are freely available from supermarkets and chemists, and the symptoms are no better, then it isn't lactose intolerance.
Right.
And one possibility is that it's a cow's milk allergy. There's other possible things as well. It could be an infection in the gut, other possibilities too.
Okay.
But I would go back to the GP and say, look, if this is lactose intolerance, this would get better on a lactose-free formula. It hasn't, so we need to think again of what else it might be.
Brilliant, brilliant.